Very good morning, my dear students. Today, we will see a presentation regarding doctor-patient relationship. Myself, Dr. Yatish Kumar Joshi, and under the supervision of my guide, Dr. Sunita Vaga, I will be giving you this presentation. So, in today's session, we will see the following things. What is doctor-patient relationship? What is Parsons model of ideal patient and doctor? And what are types of doctor-patient relationship? What are the consultation styles? Influences on doctor-patient relationship. Doctor-patient relationship in the past. Doctor-patient relationship at present. And steps to improve doctor-patient relationship. So, let us begin. The doctor and their patients have a unique social responsibility or relationship where bonding is planned with the ultimate objective of assisting the patient to achieve treatment goals. This approach requires the doctor, that is the care provider, to take on the responsibility of directing, effecting, and maintaining the therapeutic relationship, exhibiting a professional and ethical approach. So, in short, this doctor-patient relationship is aimed towards providing the effective care to the patient. So, why does it matter? A patient-physician relationship is fundamental for providing excellent care to the patient. It also aids in the healing process, which in turn improves the outcome of the overall interaction between the physician and the patient. Therefore, it is important to understand what elements comprise the relationship and identify those that make it good. So, Parson in 1951 gave a model for ideal patient and doctor and types of doctor-patient relationship. So, we will look into the same. First, according to Parsons, what is an ideal patient? It is the party which is playing the sick role, or in the communication, the person who is sick, he is the patient. What are rights of the patients? The patient is regarded of being in need of care. That means someone who is not well or someone who is in need of care, and he or she is ready to give up some activities and take some responsibilities towards getting well. What are the obligations? Or in return, what is the patient expected to do? The patient must want to get better quickly and seek help and cooperate with the doctor for the same. So these are the roles and rights and obligations of the ideal patient according to the Parsons model. Next, according to Parsons model, what is a doctor? A doctor is someone who applies a high degree of skill and knowledge to the problems of illness. He acts of welfare of patient and community rather than of own self-interest, desire for money or advancement, etc. A doctor needs to be objective and emotionally detached from the interaction. He should be guided by the principles and rules of professional and ethical practices. So, ideally, a doctor should have high skill and knowledge of all the illnesses and should work towards the betterment of the community and the patient, and not for self-interest, desire of money or advancement. He should objectively look at the illness and should be emotionally detached from the interaction, as well as he should maintain his professional and ethical conduct. So in turn, what are the rights the doctor has? This means in the interaction, what is the doctor allowed to do? So in this interaction, the doctor is privileged to have the rights to examine patients physically and to inquire into the intimate areas of physical and personal life of the patients. So the doctor is also considered of having autonomy in professional practice. He occupies a position of authority in relation of the patients. So a doctor has all these privileges which he should utilize with high professional and ethical conduct. Next, we will see the doctor-patient relationship. So this classification is based on locus of control. Who has the control in the relationship? If the physician has control, the physician can have low or high involvement in the interaction. Or else if the patient has control, the patient can have high or low control in the interaction. So based on these criteria, four situations are outlined which give us four type of doctor-patient relationship. First one is where the patient control is low as well as the doctor's control is low. That is default type of relationship. Next is where the patient control is high and the doctor or physician control is low. That is called as consumerism. We will be seeing all these individually in the forthcoming slides. Next is when the physician's control is high and the patient's control is low. That is called as paternalism. And last, which is the most ideal one, that is patient control is high as well as physicians or doctors control is high. That is called as mutuality, which is the most desired relationship. So let's see them all individually. First one is default. If you remember, it is a relationship where both the doctor and patient have low control. So when the patient and physician expectations are odd and when the need for change in relationship cannot be negotiated, this relationship comes to a dysfunctional standstill, which means neither the patient is cooperating in the relationship nor the doctor is interested in the relationship. Such relationship indicates that they need to change either the physician or they need to change in their attitude towards their involvement in the relationship. This is mostly a non-beneficial type of relationship. Next is paternalism. It is widely regarded as the traditional form of doctor-patient relationship, a passive patient and a dominant doctor. What are the advantages of paternalism? The supportive nature of paternalism appears to be more important when the patient is very sick. In such situations, the patient might not be able to take decisions for himself. There is a relief of burden of worry in curative. That means when the patient is relieved that he is in a good hands and he can trust the doctor, he is relieved of this worry. This itself works as a curative measure. Hence, it is called as medicinal magic or placebo effect. You all might have heard this that as soon as I meet this doctor, half of my illness is healed. Or as soon as we go to the doctor, half of my pain has gone. That is a placebo or a medicinal magic. This occurs because the relief of burden which the patient experiences after meeting the doctor and explaining his illness, that now the way for cure is approaching. So this is the advantage of paternalism. Similarly, there is disadvantage of paternalism. If the doctor does not maintain the professional and ethical conduct in his practice, there can be manipulation and exploitation of the vulnerable and ill patients. Next, we will look into mutuality. Now, as I told you earlier, mutuality is the optimal doctor-patient relationship model. This model views neither doctor or the patient as a standing aside. They both are participating. Each of the participant brings strength and resources to the relationship. Based on the communication between doctors and patient, this relationship brings out good outcomes. So what are roles of the patient? The patient need to define their problem in an open and full manner. And the patient has the right to seek care elsewhere when demands are not satisfactorily met. What are the doctor's roles? The doctor need to work with the patient to articulate the problem and refine the request. The physician's right to withdraw services formally from a patient if he or she feels it is impossible to satisfy the patient's demand. So in mutuality, both have to cooperate at their maximum efforts towards solving the problem of the patient, as well as both have the right to withdraw the care if they feel that this relationship will not end up in providing patients' demands. What are the advantages of mutuality? Patients can fully understand what problem they are coping with thorough physician's help. Physician can entirely know patient's value. Decisions can easily be made from a mutual and collaborative relationship. The optimal doctor-patient relationship model serves to bring a positive outcome. What are the disadvantages? If the communication is fake, both physician and patient do not have mutual understanding. Making decision is very overwhelming to a patient. So not all the patients can be prepared to be a partner in making decisions. The doctor needs to strive to make them understand as well as get prepared to take part in decision. But mutuality in overall is the most optimal type of doctor-patient relationship. The next type is consumerism. This is a reverse of the very basic nature of power in relationship. That means initially the doctor was the most dominant part and the patient was passive part. In this consumerism, the patient takes active role and the doctor is adopting a fairly passive role. So what are the roles of patient? The patients basically in consumerism are health shoppers. So what are the indications that they are health shoppers? They display the characters of cost consciousness. They are mostly concerned about the cost of the treatment rather than the benefits and limitations of the treatment. They are more of information seeking. They try to evaluate the doctor regarding his eligibilities and his expertise rather than the problem they are experiencing. They exercise independent judgment, which means they oversee the advices or the judgment of the doctor and rather have a preconceived independent judgment behavior. In this relationship, what is doctor's role? A doctor is merely a healthcare provider or a technical consultant to the patient. To convince the necessity of medical services, the doctor has to struggle in this type of relationship because the patient has a preconceived independent judgment regarding his illness or need of his treatment. So what are advantages of consumerism? Although this doesn't sound like an effective doctor-patient relationship, but still it has one advantage, that the patient can have their own choices. Some patients prefer to have their own choice of treatment. But there are bigger disadvantages of consumerism, which when things seem to go wrong, when satisfaction is low, and when a patient suspects that less than optimal care or outcome is seen, the patients are more likely to question the physician's authority. So, in this type of relationship, the doctor should be very cautious while handling the patients, because such type of patients tend to question the physician's authority in the due course of their relationship. So, after we saw the types of doctor-patient relationship, which were mutual, paternalism, default, and consumerism, we will next come to consultation styles. So while interacting with the patient, the doctor-patient relationship is established. So this interaction can be basically of two types. First is a doctor-centered approach, or second is a patient-centered approach. So what is a doctor-centered approach? It is a paternalistic type of approach in which the doctor is the expert and the patient is expected to cooperate. It is a tightly controlled interviewing style aimed at reaching an organic diagnosis, which means the patient has less freedom towards expressing his own expectation or views. All the questions asked are closed-ended questions. That means the patient can answer mostly in yes or no, available or not available, happened or not happened, etc. The patient cannot give a varied answers. Next, the voice of medicine. That means the focus on biomedical diagnosis and treatment as quick as possible. That means less amount of time is invested and the main diagnosis is based on biomedical. Other aspects such as social and psychological aspect of the illness are not considered in a doctor-centered approach. Next type is a patient-centered. A patient-centered approach basically works on the principle of mutuality, which we saw in the previous slides. It is a less authoritarian type of approach. It encourages patient to express their own feelings and concerns. The questions asked by doctors are not close-ended, they are open-ended. That means the patient is expected to answer based on his own expectations, feelings, and level of understanding. The voice is of patient. That means if you remember, the doctor-centered, the voice is of medicine. In patient-centered, it's the voice of patient. That means communication of patient's beliefs, feeling, and psychosocial context, or the biopsychosocial expression of the patient is encouraged in this type of patient-centered consultation style. Ideally, the consultation style should be a teamwork. It should involve both doctor and patients as a team towards the outcome of providing care. We will see the patient-centered consultation style in more detail. The key aspect of a patient-centered consultation are: first aspect is biopsychosocial perspective. That is, we should understand the illness incomplete. The doctor should not only focus on the biomedical aspect of the illness, but rather should also focus on the psychological aspect and the social aspect or the perspective of the patient that the patient is experiencing due to the illness in his current position. Next, it is important to understand the patient as a person. Not every patient is same. Every patient has different ways of expressing their concerns. It is important to understand the patients and communicate with the patient in a way that they will be open to respond to all the questions of the doctor. Only after you understand the illness and the patient properly, we can expect cooperation with the patient, or we can encourage the patient to cooperate. When we see cooperation of the patient, then we can share power and responsibility with the patient. That means decision making or diagnosing the illness and the need of the care is traditionally the responsibility of the doctor. But in patient-centered consultation, this responsibility and the power is shared by both the doctor and the patient. They both are involved in making the decision regarding the illness and the desired care. So after making the decision, the doctor can, now the patient is more educated regarding his illness and the required treatment. The therapeutic alliance can be established. This therapeutic alliance is established by understanding and agreement on the treatment. That means the patient, once he understands his illness and the available treatment options, as well as when the doctor understands the biophysiological perspective of the illness and patient as a person, they can form a therapeutic alliance. And this alliance, based on the understanding and agreement of both patient and doctor, can bring out an optimal treatment outcome. The last factor is the doctor as a person. During the whole consultation or the interaction, it is important that the doctor remembers to be humane. The humaneness of the doctor is a very high professional conduct. This encourages the patients to be more open and cooperative, as well as sharing the power and responsibility with the doctor. It is also similarly important that the doctor should be empathetic. He should be detached from the situation, and he should be empathetic towards the illness of the patient. It is important that the doctor provides the adequate amount of time in professional limits to the patient to be successfully achieve the care and gain the wellness that it is desired. As well as a sense of awareness towards the interaction should be maintained by both the doctor and the patient, that they are collaborating or interacting with the sole purpose of achieving the goal, that is achieving the wellness or care that the patient demands to the illness which he is experiencing. So in short, it is important to understand the illness, it is important to understand the patient. Next, it is important to involve the patient in making the decision, as well as it is important that the patient understands and agrees on the treatment plan. And it is also important that the doctor has humaneness, empathy, time and awareness regarding the interaction or the consultation. So I hope you understand the patient-centered approach in a more depth now. So what are the factors that influence the doctor-patient relationship? Doctor-patient relationship is mostly influenced by three things. First one is influence of time. Now that the doctor-patient ratio in most of the developing countries has not yet been met, few doctors have huge amount of patient flow. So based on the patient flow, they give time to their patients. But it is more important, as you have seen in the previous slide, to give adequate time to every patient. On an average, a consultation lasts for 2 to 20 minutes. On an average, a 6 minute. The pressure of time will lead to a doctor-centered consultation. It is important to remember that the patient-centered consultation and a teamwork is more important. But lack of time can lead the doctor to ask more close-ended questions and or not having time to give options to the patient regarding expressing their feelings and concern. It will lead to a more doctor-centered consultation. However, doctor's own style and approach influences than the time available. This means Investing more time in the initial consultation may reduce the future recalls of the patient, thus overall reducing the consultation time. This needs to be considered. So in patient-centric approach needs more time, but overall reduces the return visits, thus total time of consultation. It is beneficial for both doctor and the patient. Next factors are the patient's characteristics and behaviors. The patient's ability to exercise control depends on number of factors like age and sex, social and educational level, and different languages that they speak. It is important that the doctor considers these factors. Not all age patients are able to express their concerns easily. Educated patients have a more knowledge and more awareness regarding their illness. In current context, the use of internet, the educated patients have already gathered knowledge from internet or Google, and they have a varied levels of expectation from the treatment. This preconceived knowledge has influence on doctor-patient relationship. The doctor should be very careful and should be knowledgeable to maintain his limits while interacting such patients. Different languages. It is very important to know whether the patient can understand clearly the language that the doctor speaks. If the patient is not able to speak the language, it is important to have someone, some relative of the patient or assistant of the doctor to be an interpreter who can communicate with the patient to establish proper ground of communication and eliminate the language bias. Not only the vocal language, but also the body language needs to be considered. The tone of voice and the gestures of the body and the face while being in the doctor-patient relationship are very important. They can have a profound influence on the doctor-patient relationship. Next, a third aspect is influence of structural construct. That means the hospital or the ward situation and fees of the services. As you all are aware, these two are very profoundly influencing the doctor-patient relationship. The bigger the hospital and more posh the hospital or more sophisticated the ward is, and the higher the fees of the services are, the patient tends to be more reluctant or more less open to the patient or more demanding to the doctors. This needs to be considered that the type of situation and the fees of services should be optimally balanced with the expectation of the patients, and doctor-patient relationship should be balanced according to that. So, in the past, what were the type of doctor-patient relationship? As you all might have heard that doctors are next to God. This was considered in earlier days where there was sole paternalism of the medicine man or the doctors, because physicians in the past were people who have higher social status. Doctor is seen as a sacred occupation which saves people's life. The advice given by doctor are seen as paramount mandates, and the doctors were considered next to God. But the things have changed now. Currently, the doctor-patient relationship is either consumerism or mutuality. Less amount of paternalism or default is seen, but mostly they are consumerism or mutuality. Patients nowadays have higher education and better economic status, and internet has also increased their ability of self-diagnosis. The concept of autonomy of patient has evolved. They are having the ability to question the doctor. So these things are to be considered by the doctor while interacting with all the patients. There should be either a mutual relationship, but the doctor should be careful to avoid consumerism in the relationship. So what are the steps that a doctor can take for improving doctor-patient relationship? So this slide will basically summarize today's lecture. The doctor should be an active listener. He should listen to the patients clearly. He should be able to understand what the patient is trying to tell. Not only the words that he is speaking, but he should also be able to understand what he is not able to express in terms of words. He should concentrate on non-verbal communications, body language of the patient, as well as the expectations of the patients. Also, it is important that the doctor maintains a good non-verbal communication or a body language while interacting with the patient. The third aspect is setting agendas. In this relationship, the goal should be preset. That is, the patient is seeking care and the doctor is providing care, and the goal is to give optimal care to the patient. Once the agendas are set and both the doctor and patient agree on to the agenda to reach the goal, the relationship can have a positive outcome. Next is empathize. The doctor should empathize with the patient. He should be detached from the situation, should not get emotionally attached, but should have empathy with the patient regarding his illness. The doctor should educate the patient regarding his illness. He should take time to educate the patient. Once the patient is able to understand about his illness, the reasons, possible treatment plans, the patient becomes more aware of the situation and cooperates more with the doctor. Some patients cannot easily understand, are more emotionally unstable. You need to be reassuring to the patient. Reassurance is the biggest key of a successful doctor-patient relationship. Most of the patients are worried and are anxious. A simple step of reassurance or recounseling the patients can help them to cope up with the situation, and this in turn improves the doctor-patient relationship. Next aspect is agreeing on the treatment plan. By following all the above mentioned steps, it is easier to make the patient understand his problem and the treatment option available. Provide him with the benefits and limitations of every treatment plan. So the doctor and the patient can agree upon the most optimal treatment plan and then work towards achieving the same together. Responsibility. Like I meant, you should be taking responsibility and sharing responsibility with both doctor as well as patient. Once the patient has a sense of responsibility in achieving the goal of care, his participation amongst the relationship becomes more active. From uh, default, it moves towards mutuality. Next is avoiding overreacting. There are many instances in a doctor-patient relationship where the patient can exhibit a more demanding or the doctor can exhibit a passive role. Such overreactions towards the events in doctor-patient relationship should be avoided. This ensures a long-term positive or optimal doctor-patient relationship. And the last but not the least, the most important point is establishing boundaries. It is important that the doctor establishes the boundaries of this relationship based on his professional and ethical conduct. So all these steps are very important to improve a doctor-patient relationship. To summarize, I would like to tell that today we have covered what is doctor-patient relationship and why it is important, what is Parsons model of ideal doctor and ideal patient, what are types of doctor-patient relationship? We saw them in detail. That is default, paternalism, mutuality, and consumerism. Later on, we saw the doctor-centered and the patient-centered consultation style. We saw the factors that influence the consultation or patient-centered consultation. Then we saw into the factors that influence the doctor-patient relationship. Then what was the scenario in the past and the scenario at present, and in the last we saw the steps to improve doctor-patient relationship. So with this words I would like to end my lecture. If you have any doubts regarding the same, you can contact me on my mail ID or on my WhatsApp number. I will get back to you as soon as possible. At the end of this lecture, there are two questions that have been posted in the classroom. They are the two case studies. Kindly go through them and answer the questions. Thank you.